Dr. Amir Hassan with Valley Baptist Medical Center is here to talk more about what people should look out for. Thank you so much for joining us.
Oh, thank you for having me. So acute ischemic stroke signs, the American Heart Association created this great acronym FAST. So if you have face weakness, arm or leg weakness, slurred speech, it's time to call 911 and get to your closest emergency room.
And you deal with patients on a daily basis. This is where you see the most patients. And do you see people kind of pushing it to the last minute?
Yes, we actually have a lot of patients who come in very late. They're coming in, they might have had the event at night and then they said, oh, we'll sleep on it. So that is actually very dangerous. The fastest you get in to a primary stroke center, the faster you can get the IV clot buster, which breaks up the clot and is proven to improve your outcome.
And what would be one of the key symptoms that you should go right away? Because whenever you're seeing your patients, they probably are exhibiting several, but what's one of the key factors as to, it's time to address this with the doctor?
So usually it's weakness on one side, slurred speech. Those are the biggest symptoms. Sometimes you get a little facial droop, having trouble with coordination. Some people just have balance issues. So any of these issues, the worst headache of your life, any of those things, you should call 911 and get to your closest ER.
Yeah, and you were telling me that for Valley residents, Valley Baptist Medical Center is the only option when you get to that point. If you walk in and find a loved one on the floor, you really only have one option of where to take them so they can have help.
Yes, so Valley Baptist is the only comprehensive stroke center south of San Antonio. So we cover the whole valley, and for patients who are outside of the time window for the IV clot buster, if you had breakfast with your loved one, you came back from work, they're on the floor, you have no idea when that stroke occurred, or if they wake up with a stroke. Those patients can still get something when they come to a comprehensive center. We do advanced imaging, and then we take the little tubes up, we try to pull the clot out or suck it out and open it up. And
you've seen that has proven to be very successful with the patients that you see.
Yes, we've had 5 consecutive trials done, and we were part of the only U.S. trial. We were the only site in Texas, and the trial was positive, published in New England Journal of Medicine, one of the most prestigious medical journals, and did show significant difference with good outcomes.
Good. Well, to prevent people from getting to that, what are some things that they should be doing with, whether it's their diet or level of activity?
So yes, they actually recommend 30 minutes of activity 5 times a week. If you're diabetic, controlling your sugars, trying to decrease your carbs, control your blood pressure if you have hypertension. Continuously see your primary care physician. I can't stress that enough. I mean, eating well and exercising are great things, but if you have a condition, whether it's hypertension, diabetes, any other disease, need to see your doctor, continue your medications. You wouldn't believe how many patients come in who are not taking their meds or their prescription ran out, they couldn't get a doctor appointment because they don't see their physician usually continuously throughout the 3-month or 6-month or 9-month follow-ups.
And right, and some people might assume that it's only older people who get it, but stroke, it can occur at any age.
Yes, we've treated patients, actually, usually younger patients. It occurs because of a disease, a specific disease or trauma. But yeah, we've treated everybody from 6 years old to 103.
All right, well, thank you so much for joining us.
Thank you for having me.